spinal spondylosis. This is the wear and tear pathology in the human spinal cord at various levels. The spinal column in human being has been divided into cervical, thoracic, lumbar and sacral region, and it consists of vertebral columns, spines, vertebra, intervertebral discs and foramens through which the nerve fibers passes out of the spinal cord. As the age advances, the activity of the osteoclasts, which are responsible for degeneration and destruction of the bone matrix, they become active. So there is wear and tear, that is osteoarthritis disease onset is superant. So this spondylosis is mainly divided into cervical spondylosis and lumbar spondylosis, because the thoracic vertebra and the spines, they are very firm one, and they have been additionally supported by the ribs and rib cage. They are very firmly fitted one, and they are able to resist the tension, stress and trauma comparatively in better fashion as the vertebra or spine of the neck or the lumbosacral area. If there is pathology of degeneration in cervical spines, that is called as cervical spondylosis. Usually it occurs near the age of 60 years. I mean in elders ones. While the lumbar spondylosis, that is usually appears at the age of 40 years. The lumbar spines, they are the nerve roots which passes from the L4, L5, S1, S2, S3 that merges out of the foramen into the buttock, going on back of the thigh, back of the leg, into the feet and the toes. The bundle of nerve fibers that passes out of the sacrolumbar region, they are in the forward bundle and they form a big nerve, which is the biggest nerve in the human body, that is called as sciatic nerve. So there is inflammation, impingement, pressure of the various muscles and ligaments, and the bony spurs, etc. They are compressed. Due to compression of these nerves and their distribution tributaries, the various symptomatology appears, which is we term that as sciatica, and they mostly affect the lower limbs. While in cervical spines, due to degeneration of the intervertebral discs, the various nerves which emerges out of the spinal canal, passing into the upper limb, the forearm, upper arm, into the hands and the fingers. So the nerves and nerve fibers, they are compressed, they are pinched up by the surrounding inflammatory process. What are the causes of this compression? Occlusion of the neuromuscular impulses due to the pressure and pathology, nutritional deficiency, prolonged deficiency of the calcium, phosphate and the vitamin D3, traumatic injury to the vertebral or spinal column, spinal bone spurs and spinal canal stenosis, and mostly about 90% of the cervical spondylosis is produced by the herniation of the discs. Intervertebral discs, they are composed of two parts. The outer is very hard one and resistant and can oppose the traumatic stress to some extent. That is called as annulus fibrosis. While the inner portion is soft and jelly-like, that is called as gluteus pulposus. So when the wear and tear and osteoarthritis occurs in the cervical spines, the outer most hard portion of the vertebra becomes soft, cracked one, due to which the inner soft jelly-like portion that protrude out and produces herniation of the disc. And this herniation portion, which is out of the alignment of the spinal column, that produces pressure, compression of the nerve, produces inflammation and irritation of the nerve, which passes into the upper limb and causes the various symptoms. Now the symptoms produced by the spondylosis, especially in the cervical spondylosis, there is dizziness, headache, nausea, vomiting in general, while there is neck rigidity, stiffness, and the neck pain that radiates into the upper arms, into the hands and the fingers. Especially the interscapular muscle, they are also stretched one under spasm, and that also produces pressure and occludes the conduction of the impulses in the nerves onwards into the muscles. So these are the major causes of spondylosis and the production of the symptoms by compression of the nerves. Spinal spurs, bone spur, spinal canal stenosis, foraminal stenosis, traumatic injury, and mainly the disc herniation. These are the major causes of the spondylosis in any region, whether it is in the neck, whether it is the lumbosacral spine area.